Despite their efforts, the Directorate of Health Services and the management of BITS Pilani have not succeeded in curbing the outbreak of hepatitis A and the BITS Pilani campus in Goa. On the contrary, 131 students were found to be suffering from the disease on Wednesday.
It was in September last that 48 students of BITS Pilani were found to be suffering from hepatitis A, commonly called jaundice, but what really set off panic at the campus was the new 131 hepatitis A cases detected on Wednesday. Speaking to Goa 365, Dr. R.P. Pradhan, the Public Relations Officer of the Birla Institute of Science and Technology, refuted that the 131 cases were new, saying that these cases were the continuation of earlier cases detected in September last.
Yeah, let me first of all clarify that this is not the second time it's happening. This is continuation of the earlier case that was reported here in the third week of September. 22nd September, 48 cases were reported, and then that time medical advice was that a number of students might have contaminated, which may manifest sometime later. So medical community, they are of the opinion that till end of October such cases are likely to be reported.
He said that one of the bore wells within the campus was the possible source of contamination as it has been sealed.
One possible cause could be that one of our bore well, maybe because of the monsoon, closing monsoon heavy rains, that might have developed some leakage somewhere, and that appeared to be a possible source of contamination. But to handle this whole scenario, we have taken multiple approaches. First of all, there's a massive vaccination drive that we have initiated, and more than 80% of our students, they have already been vaccinated against this development.
The President of the Students' Council, BITS Pilani, Akhil Mehta, has requested the people not to panic about the situation and further assured that all efforts have been made by the BITS management involving the Students' Council to bring the disease under control.
As most of you might know, jaundice is more of a symptom than a disease actually. The disease is hepatitis A. So basically what happens is when you get infected by hepatitis A, in the first 2 or 3 weeks you don't show symptoms at all. So when we closed down the campus, we weren't sure of the extent to which the people had been infected, which is obviously showing now. The first thing that the Students' Council had to do was to make sure that there were no rumors flying around, because obviously in such a situation panic may spread and lead to false alarms. So we have been going into all hostel common rooms and spreading information about jaundice and what all has been done so far.
He denied that the new cases detected would affect the annual cultural festival Waves to be held in the first week of November at the BITS Pilani campus.
Waves, our annual cultural festival, is starting from 6th and ending on the 8th of November. So as you can see, there's no overlap between the infection time and the festival time itself. So there is no change in the schedule or the expansion or the extent of the festival.